Welcome back. Our next guest is Kimmy Everman, the director of the Montana State Health Insurance and Assistance Program, or SHIP. Kimmy, welcome to the show.
Hi, Beth. Nice to be here.
Good. Can you just start out by talking about what SHIP is?
Certainly. Really simple. SHIP is a network of highly trained counselors who are trained in Medicare and a lot in Medicaid and different helping programs, etc., for Medicare beneficiaries. They're all over the state. Every state has one in the United States, and we are your objective, up-to-date, accurate source for Medicare information.
Great, and I understand too that SHIP counselors will go to people's homes if they can't travel. Can you talk a little bit about that?
Sure,
service?
yeah, they certainly can. I think we all know that in Montana there's many, many miles. We call it windshield time, and not everyone can get to a local site. We have a number of them, but that doesn't mean you can get there. You have a car to get there, etc. So we'll either do a phone consultation, which some folks are fine with, or there might be a person who is willing to come on out to your house, to someplace in your town, say a community center for the afternoon, just any way to get a one-to-one connection with you as the client, because so much of this is hard to understand unless you're actually talking with a person.
Sure. And does SHIP help with Medicaid members as well?
You know, it really does, and more and more, we're seeing more and more Medicaid work, but it's important to remember that you need to be Medicare and Medicaid eligible, and that's called a dual eligible, and that means that you are either blind, aged, or are medically needy. That would be the Medicaid side. Also, you have a very low resource level and asset level. And those are set by Congress. Those are not anything that we at the state can change. But certainly, if you think you're in that category, I bet we can put the number up on the screen. Call a SHIP counselor and see if there's anything we can do to help, at least financially, put you on your feet a little better.
You talked about Medicaid eligibility. What about Medicare eligibility?
Sure. Medicare eligibility hasn't really changed a lot. You know, a lot of people know that for their full retirement age, myself, I have to go to 66 years old, I think. It's longer. Medicare is not the same. You still get it at age 65, at least in 2017. You need 40 work credits, which actually comes to about 10 years of full-time work. You can work a couple years here, a couple years there. It's especially great for mothers who've had to stay home with children and haven't had a full-time job their entire working life. As long as you have what comes to 10 years of work, you are eligible for Medicare with no cost for the A premium. That's your hospital premium, and your B premium is your outpatient, and that's about $130 to $150 a month.
Okay, and there are different eligibility periods.
There
right,
are.
For Medicare. Can you talk about that a little bit?
Sure. When you first turn 65, you have 3 months prior to your birthday, 3 months, or your birthday month, and 3 months after. You also have every year, there's an annual enrollment, which is from October 15th through December 7th, where you should be always looking at your Medicare plans to make sure they still fit you. Things turn over then on the 1st of January. And then in January through March, there is another called a general enrollment period that, although it's good to have it, we want people to avoid it if they can, because it usually means they haven't signed up when they could have, which means penalty sometimes.
Oh, okay. And can you just give us a general overview of what the different parts of Medicare are?
We have Part A, which is your hospital, so you go to the hospital, you're in a terrible accident or something. Part B is when you just go to the doctor's office or the lab or whatever. I'll come back to C. Part D is the drug piece, which is the newest, and you can buy your drugs through that plan. And then Part C are known as Medicare health plans, and they encompass all of the other three, A, B, and D. So you get everything under one roof. We kind of call it a one-stop shop. One thing people need to remember is that you're often asked to use a network if you buy a Medicare Advantage plan.
Okay. And can people just choose to be in one part of Medicare, or how does that work?
Well, you can choose either traditional Medicare model, which is you have A and B and D, and that means any doc that'll take that Medicare you may go to. Or you can choose the Medicare Advantage or the Medicare Health Plan avenue. If you choose that, you usually have to go to the doctors and the facilities that company wants you to go to. So it's called a network. Either way, you're always a Medicare beneficiary, and you always get the Medicare beneficiary assistance and respect and all of that. It just comes to you in different ways.
Okay, and so just so people better understand some of those terms, there's original Medicare and then there's Medicare supplements. Can you talk about the difference?
Sure. A Medicare supplement is actually, it only goes along with a traditional Medicare model. And what it is a kind of an extra or secondary insurance policy that someone will purchase to go along with traditional Medicare. Traditional Medicare has an 80-20 split. That means Medicare pays 80% and you as the beneficiary pay 20%. Buying a supplement will help you pay that 20% out of pocket.
Okay, great. And when should someone get a supplemental plan, just really quickly?
The best time is the first 6 months after they turn on their Part B Medicare. They should call a SHIP counselor to find out why, because it's really important.
Okay, great. Kimmy, thanks so much for being here and all that information.
Absolutely.
We'll have some financial planning information for you right after this. Stay with us.